area doing a point in time survey.
Okay, what's that mean?
A point in time survey is where we come and assess the needs of your community so that we can better serve your community. And so is that something that you would like to participate in?
Sure.
Okay. So due to the nature of your situation, your information, it will be done in confidentiality and de-identified so that no one would know who you are. Is that okay?
Okay.
Okay. And your name, can I get your initials on it?
Yeah, ALH.
And what is the year of your birth?
1986.
And what is the last 4 digits of your social?
Why do you need that?
Well, it's just information to help us, but it won't be used to identify you in any way. That's why we only ask for the last 4 digits.
I'm not comfortable giving that though.
Oh, that's fine. And are you of Hispanic descent?
No.
And what's your race?
I'm white.
And where did you sleep last night?
I was here at the shelter.
How long did you stay in your previous place where you lived?
Before coming here,
Yes.
I was there 6 months.
In the past 3 years, how long have you been homeless?
I guess 3 or 4 times.
And if you could put that into a number, how long, in months or years, how long would you say you've been homeless?
About a month and a half.
About a month? And including this time at the shelter, how many times have you been homeless and to a shelter?
Twice.
And is it just you at the shelter, or do you have children?
I have a child with me.
Okay. And is that a girl or boy?
I have a daughter.
A daughter? And what's the initials of your child?
SLH.
And how old is she?
She's 3.
Okay. And what would you say is the cause of your homelessness?
I left when my boyfriend was hitting on me.
Okay. Have you ever served in the military?
No.
Do you have any health insurance right now?
No.
And this question, have you ever been diagnosed with or told that you have any of the following physical disability?
No.
A mental health?
Yes.
Developmental?
No.
Drug abuse?
No.
A chronic health condition?
No.
Alcohol abuse?
No.
HIV or AIDS?
No.
Okay. Now I'm going to ask you some questions about your interactions with health and emergency services. If you need any help figuring out when 6 months ago was, please just let me know, okay?
Okay.
How many times have you been to the emergency room?
4 times.
Okay. How many times have you had interaction with the police?
5 times.
How many times have you been taken to the hospital in an ambulance?
Just 2 of the times.
How many times have you used a crisis service, including distress centers or suicide prevention hotlines?
Probably about 5 times.
How many times have you been hospitalized as an inpatient, including hospitalizations in a mental health hospital?
Can you repeat the question?
How many times have you been hospitalized as an inpatient, including hospitalizations in a mental health hospital?
Just once in the mental health.
Okay. Have you ever been attacked or beaten up since becoming homeless?
No.
Threatened to or tried to harm yourself or anyone else in the past year?
No.
Do you have any legal stuff going on right now that may result in you being locked up or having to pay fines?
No.
Does anybody force or trick you to do things that you don't want to do?
Um, yeah, my boyfriend does.
Ever do things that may be considered to be risky, like exchange sex for money, run drugs for someone, have unprotected sex with someone you really don't know, or share a needle or anything like that?
No. That's really personal.
It is, and keep in mind that this is confidential, so your information is just used to assess the needs of the community. I'm going to read different types of places people sleep. Please tell me which one you sleep at the most. A shelter, street, sidewalk, or doorway, car, van, or RV, park, or bus station, or some other place.
The shelter.
The shelter. Is there anybody that thinks you owe them money?
Yes.
Do you have any money coming in on a regular basis, like a job or government benefits, or even working under the table, beaning or bottling collecting, sex work, odd jobs, day labor, anything like that?
I have a regular job.
Okay. Do you have enough money to meet all of your expenses on a monthly basis?
Yes.
Do you have planned activities each day other than just surviving that brings you happiness and fulfillment?
No.
Do you have friends or family or other people in your life out of convenience or necessity, but you really do not like their company?
Yes.
Do friends, family, or other people in your life ever take your money, borrow cigarettes, use your drugs, drink alcohol, or get you to do things that you really do not want to do?
Is this going to take much longer?
We have a few more questions. If you could just bear with me a little longer.
Okay.
It's just a few more questions, okay?
Okay.
Where do you usually go for health care when you're not feeling well?
To a clinic.
Do you now have, or have you ever had, or have a healthcare provider ever told you that you have any of the following medical conditions? Kidney disease, end-stage renal disease, or dialysis?
No. Is this going to take a lot longer?
We just have a few more questions, so it'll just be a few more minutes.
Okay.
Is that okay?
Yeah, it's getting kind of long. Okay.
History of frostbite, hypothermia, or immersion's foot?
No.
Liver disease, cirrhosis, end-stage liver disease?
No.
AIDS or HIV?
No.
History of heat stroke or heat exhaustion?
No.
Heart disease, arrhythmia, or irregular heartbeat?
No.
Emphysema?
No.
Diabetes?
No.
Asthma?
Yeah, I have asthma.
Cancer?
No.
Hepatitis C?
No.
Tuberculosis?
No.
Have you ever had a problematic drug or alcohol use, abused drugs or alcohol, or someone told you that you do?
No.
Have you consumed alcohol or drugs almost every day for the past month?
No.
Have you ever used injection drugs or shots in the last 6 months?
No.
Have you ever been treated for drug or alcohol problems and returned to drinking or using drugs?
No.
Have you ever used non-beverage alcohol like cough syrup, mouthwash, rubbing alcohol, cooking wine, or anything like that in the past 6 months?
Not to drink. No.
Have you ever blacked out because of your alcohol or drug use?
No.
Ever been taken to the hospital against your will
No.
for a mental health reason?
Not against my will.
Gone to the emergency room because you wasn't feeling 100% emotionally or because of your nerves?
Yes.
Spoken to a psychiatrist, psychologist, or other mental health professionals in the last 6 months because of your mental health, whether that was voluntary or because someone asked you to do so?
Yes.
Had a serious brain injury or head trauma?
No.
Ever been told you have like developmental disability?
No.
Do you have any problems concentrating or remembering things?
Sometimes.
Have you had any medicines prescribed to you by a doctor that you do not take
No.
or that you sell?
No.
Had stolen or misplaced or never had filled?
No.
Have you ever experienced any emotional, physical, psychological, or sexual, or any type of abuse or trauma in your life in which you have not sought help for, or which has caused your homelessness?
Yeah.
Thank you so much. I know some of the questions were a little personal and just digging a little deep for you, but I do thank you for your participation in the survey, and it will help us to continue to do the work that we're doing for the community.